Interpretation of clinical test result, it is important because in diagnosis, monitoring and the screening, the clinical laboratory test results are very essential parameter. Without clinical laboratory test results, you will not able to diagnose the disease. In addition to that, now suppose if you have started the pharmacotherapy, you have started the treatment. Now you want to monitor that treatment in terms of its effectiveness. So when we are expecting to measure the effectiveness of the treatment, so that also you will measure in terms of certain laboratory test result, isn't it? Also, the screening, you need to perform laboratory tests, and based on laboratory tests, you can ensure that the patient is responding to the treatment and appropriate drug therapy is given to the patient. So 70 to 80% of the judgment, especially in case of the diagnosis, are based on laboratory result and their analysis. So without doing laboratory result analysis, you will not able to do the judgment of the diagnosis of the disorder. Sometime in case of complex situation or in case of the complex disorder, the patient has to undergo the series of tests. So it is not just one test, maybe the blood test, the urine analysis, sometimes the test related to photography. So all this you have to perform, and after collecting this data will be analyzed, and based on the experience of the pathologist and the physician, they are in position to accurately diagnose the disorder. Mostly 70 to 80% of the judgment of the diagnosis are on the basis of laboratory test result analysis. Hence, various data are delivered, and it is important for the patient care and the safety that doctor are aware with the laboratory test and clarification of the result. So now here I have mentioned about a doctor being hospital pharmacist. You must also aware with the laboratory test and also the clarification of different results. For example, if patients coming to you with certain laboratory test result, and if he want the second opinion of you as his family pharmacist, isn't it? Like doctor has given certain medicine, and as a community pharmacist, he is coming to you with certain diagnostic test result, and he is asking for second opinion. If you have the knowledge and you have the skill of interpreting this clinical laboratory test data, then you will be in position to give the second opinion. So this will also increase your rapport in front of the patient. So this is also one of the important reasons why as a pharmacist also you should able to interpret these results, especially to take the patient care and to ensure the safety of the patient. So the laboratory result should be elucidated on the background of the reference value. So in case of the all laboratory tests, there are the reference values. There are some standard values. And based on these standard values, you can able to identify whether patient is normal or patient is suffering from certain kind of the disorders. So if the readings are the abnormal, that clearly indicate that the patient may suffer from certain kind of the disorder. So if you look at the diagnostic test report, so in that there is separate column where they mention the reference value, or they call it as the normal value. And as a pharmacist or as a physician, he look at that report and see how much is deviation from that particular reference value. And based on that, he will able to differentiate whether patient is suffering from the disease or he having the good health. So that is based on the reference value. So if you can able to predict that, that is important. So reference values are there, but deviation from reference value. So how much deviation may lead to the mild disease? How much deviation lead to the moderate disease? How much deviation that may lead to serious complication? So that you must able to diagnose as experienced pharmacy professionals. Okay, so in case of the laboratory test result. So as a clinician or clinical pharmacist, you should also estimate the conclusion from biological differences. So these are the biological differences which differ from the reference value. So as a clinical pharmacist or as a clinician or as a physician, you should be able to estimate the conclusion of these data of the laboratory test. Okay. So once you're able to do that, you should know the possible risk of result of interpretation. Now, sometime what happens, you get the report, and you have also seen that studied that in therapeutic drug monitoring. Okay, there are many factors which may also lead to the wrong result. Okay, and obviously, if there is a wrong result, the wrong pharmacotherapy will be prescribed to that patient. So there are different types of laboratory tests. One of the tests is the blood chemistry. Then there are certain photographic tests. There are certain tests on the urine. There is certain test on the saliva. There are certain tests on the sputums. There are certain tests even on the feces. And there are different types of the tests. So out of this, the most important test is the blood chemistry. So you may see that in case of any the complication or any disorder, the first test it is given, it is the blood test. So mostly they give CBC, that is complete blood count, and depending upon the symptom you may explain to the physician. For example, the physician has seen that there is yellowness in your eye, so obviously if the physician suspect that you might be suffering from some liver disorder, so he may also ask you to do the liver function test, and that is for the LFT. If physicians see that there are some problems related to edema, it is there, your blood pressure is also high, then he may suspect that you might be suffering from kidney disorder. So he may give you kidney function test. Okay, so there are different markers are there. The deviation in the value of these marker in the blood, it indicates a certain kind of the disorder. So study of blood chemistry, it is a process in which a sample of the blood it is taken. So what you are doing, you are taking the sample of the blood, and from that particular sample, you are going to determine quantity of specific material. So quantity of specific material released into the blood by different body organs and the tissue. Now, these values are also normal. For example, the bilirubin, which is one of the important pigment in which the level it is generally increased in case of the liver disorder or the hepatitis. So it is the product which is released by the liver. So obviously, when there will be increase in level of the bilirubin if there is some problem in the liver. Likewise, there are some marker of the cardiovascular system. If there is impairment or minor heart attack, sometimes these attacks are not realized by the patient. But if physician suspect that there are some symptoms which indicate that patient might have this minor heart attack in the past, he may give you that particular test. So that indicates that there are certain level of damage to the heart. Okay, so with just by doing the blood test. So this blood chemistry or the blood test plays very important role in case of diagnosis of the disorder. So let's see what is the role of blood test and what kind of information you will gather from the blood test. So the blood chemistry tests are performed especially to know about the general health of the patient. So CBC is very common test to know about the general health, where all complete blood count, your RBCs, WBCs, neutrophils, okay, so everything it is count. So it gives you indication about your general health. It is also performed to check whether or not certain organs like kidney, liver, or thyroids are functioning normally. So if there is any abnormality in the kidney, liver, and thyroids, the biomarker related to kidney, liver, and thyroid, their level become abnormal. If it is normal, that indicate that they are functioning normally. These are also used to check the electrolyte balance of the body. That matters a lot. So many disorder where there is electrolyte imbalance. For example, in case of kidney disease, there is immense imbalance in the electrolyte level. In case of the heart disorder, also the electrolyte like sodium, potassium, their level may change. So these measurement of these electrolyte, it is also the indication of certain kind of the disorder. Then it help in diagnosing the disease. It provide the level of chemical to compare with the standard level and future blood chemistry level if you are performing the blood test. And lastly, check whether or not a treatment it is affecting certain organ. For example, if you have started the treatment which is related to the cancer, that is the chemotherapy, you know that the chemotherapy is so severe that it has impact on many other organs. So if you want to monitor what bad effect it is producing on different organ, you can go for all these biomarker testing. So sometime in such kind of treatment, this diagnostic test is given periodically. Maybe after 3 months or maybe after 6 months, patient has to verify, he has to go and do testing of this all laboratory tests and take the report so that he can see that whether properly drug it is given, does that drug it is producing adverse effect. If that is the case, then he can switch over to another drug so that there should not be very severe adverse effect on different organ and system. So just I have given you example of the cancer. The same is the thing in case of some specific drug as well. So there are certain specific drugs, they affect specific organ. For example, aminoglycoside, they affect the kidney. So if in that case, if the patient is on the long-term treatment with aminoglycoside, the patient has to go for the kidney function test to see that aminoglycoside has not yet produces any bad effect on the kidney. So this is also one of the important role of the blood chemistry test. And then to monitor the cancer or another condition as a part of the follow-up also, you can go for the blood test. So these are the different example of the blood test. This is just summary table. For example, in case of the renal disorder, if someone is suffering from, patient is suspected of the renal disorder, then physician will ask for kidney function test. So the kidney function test, it consists of the set of tests. It including creatinine, including test of the blood urea nitrogen, test for the uric acid, and also the test for the protein. So once you gather all this report, based on this report, the physician will be in position to diagnose whether patient is normal or is suffering from certain kind of renal disorder. Likewise, in case of the diabetes mellitus, if someone is not diabetic, but there are some symptoms which indicate that patient might having the diabetes. For example, patient is suffering from polyuria, maybe twice or thrice in a night. He has to get up to go for the urination. So that is a symptom that patient might be suffering from the diabetes. So if that is the case, you can prescribe the series of tests to the that particular patient. For example, the glucose test can be done. So this is very normal test. But in order to identify whether it is type 1 diabetes or type 2 diabetes, then you can go for the oral glucose tolerance test, which help you to distinguish between this type of diabetes. Likewise, you can measure insulin level. We'll see this in a detail when I give you notes to study. So where you will come to know that there is increase in insulin, it indicates certain type of diabetes. Decrease in insulin, it indicates certain type of diabetes. Likewise, you can go for the C-peptide test, which also give very good indication about different glycemic index. Okay. Then in case of cardiovascular disorder, there are different tests like creatinine kinase, then lactase or dehydrogenase and troponin. So these give the indication of the cardiac health. So if any abnormality is related to the heart, maybe the myocardial infarction, maybe minor heart attack, so their level it is abnormal. So creatinine kinase level it is should at a high level that indicate that patient might having the minor heart attack in the past, or that is the indication for that. The liver disorder, you can go for different enzymes. They are very well known: SGOT, SGPT, then alpha glutamyl transpeptidase, phosphatase, and bilirubin. So these are the different tests. Then there are certain general tests are also there, like the blood protein level, water electrolyte imbalance, then hematological data, total and differential count, that is complete CBC. Okay, erythrocyte sedimentation rate, leukocyte and coagulation. So once you do all these tests, you will be in position to diagnose particular kind of disease. In some complex situation, it is quite happen that physician is unable to diagnose the disease. So in that case, he can give whole body test, complete body test. Maybe he will prescribe for renal disorder, diabetes mellitus, cardiovascular test for the liver function, likewise the general body test. So when he get data of all series of these tests, he will be in position to identify where things are going wrong in your body. And accordingly, he will able to give the treatment to that particular patient. So there is significance for every test, and every test has particular importance and weightage, especially in case of the diagnosis of the disorder. So let's start with the first test, that is in case of kidney function test. It is well known as the BUN, or it is also called as the blood urea nitrogen test. So basically, you measure the level of the nitrogen which is present in the urea. And you know that the urea, it is basically byproduct of protein metabolism. As a byproduct, it produces the urea. And urea basically it is the waste product. Okay. So in case of the place where urine it is stored for a long time, you may see that this urea is also converted into ammonia, and there is a very bad smell. It's come out of that. So there is a reaction with the nitrogen, there is formation of the ammonia, and due to that there is very bad smell. So it is basically the product of the protein metabolism. And if there is abnormal kidney function is there, in that case, level of urea it is increased because it is not excreted into the urine. It is accumulated into the blood. And that is the reason why level of urea it is increased. So in case of BUN, what you are doing, the urea it is produced in the liver, and it is filtered from the blood, and it is excreted in the urine by the kidney. So any dysfunction to the kidney, there will be increase in level of the blood urea nitrogen. Okay, so that is the main significance of this test. So the BUN test evaluate the nitrogen content in the urea, and high level of the BUN, it indicates that there is kidney dysfunction. But remember that every time increase in level of BUN does not indicate kidney dysfunction, because blood urea nitrogen, it increase in some other condition as well. So for example, in case of the high protein intake, so there are some people, those who are on high protein intake, maybe those who want to build their body and body mass, they take even external protein, high level of the protein. So if such protein intake it is small, it also increases the blood urea nitrogen. So that doesn't reflect kidney dysfunction. Sometimes due to the liver impairment also there is increase in blood urea nitrogen, because the liver itself, it produces, that is the urea from the food, okay, or from the protein. The urea, it is converted by the liver. So increase in level of BUN, it always does not indicate kidney dysfunction. So there must be additional test you have to perform, so that you will be positioned to identify that yes, it is not due to high protein intake, or it is not due to the liver function, but it is only due to the kidney dysfunction. So what you can do along with the BUN, you can also perform blood creatinine test. Once there is abnormal level of the BUN, and also there is abnormal level of the blood creatinine, now it is confirmed that the patient is suffering from kidney impairment. If that is not the case, if the BUN level it is high, creatinine level it is in normal range, it indicates that there is no kidney dysfunction. There could be some another reason for increase in blood urea nitrogen. So first test you are doing BUN, and then you are going for the serum creatinine test. So you can say it is some sort of confirmatory test. So this test evaluate blood level of the creatinine, okay, and the creatinine, it is byproduct of muscle energy metabolism. If you study the metabolism of the muscle, there you might have seen that the creatinine, it is produced as a byproduct of the muscle energy metabolism, and it is filtered from the blood, and it is excreted in the urine by the kidney. Now, always remember, the creatinine, it is excreted as such in the kidney. Once creatinine, it is produced as a part of the muscle energy metabolism, it is not converted into another metabolite, but it is excreted as such into the urine. So only source of excretion for the creatinine, it is the kidney. Now, if there is any dysfunction in the kidney, it leads to increase in level of the creatinine. So that clearly indicates that there is some kidney impairment in that particular patient. So the creatinine production, it relies basically on the person muscle mass. So if person having the more muscle mass, we generally show the liter variation. Depending upon personal muscle mass, whether it is maybe the fatty, having the more muscular musculature, some are very lean. So in those cases, accordingly, there is some slight variation in the creatinine production. But mostly if the level, if it is increased, so an increased blood creatinine level, it is highly sensitive indication of impaired kidney function as compared to blood urea nitrogen. So the more reliable test, especially in case of the kidney dysfunctioning, it is the creatinine. Okay, so blood creatinine level, or sometimes the plasma creatinine level, you can, that give you more reliable indication of the dysfunctioning in the kidney. Hope it is clear to you about the creatinine. Next, it is the uric acid test. So uric acid, it is basically the end product of the purine metabolism. And sometimes the patient may suffer from increase in level of uric acid. And the condition, it is called as the hyperuricemia. So it is the result of overproduction of the uric acid in the body. So there are different factors for the overproduction of the uric acid. Sometimes even if you are taking the food which are high protein in nature, obviously the high proteinous food, when it converted, the uric acid is one of the byproduct. Likewise, if there is more destruction of nucleoprotein in the body, or in case of inborn enzymatic flaws, so you having some congenital disorder, hereditary disorder, it is such that there is, although you are taking the normal diet, but still there is more production of the uric acid. So it is seen in case of some patient where they are suffering from hyperuricemia due to the congenital problem or due to the hereditary disorder. there is more production of the uric acid, and that is very dangerous because high production of the uric acid, it may lead to the symptom that is called as the acute gouty arthritis. So there is quite possibility of arthritis. The patient suffers from pain in the joint because uric acid crystal, they deposit into the body joint and they produces the inflammation in those joints. So the uric acid deposited joint are very painful. The patient is generally is in very severe pain, and joints become very stiff because you will not able to do appropriate movement if the patient is suffering from the hyperuricemia. So this is the very important significance of the uric acid test. But there are sometimes patients suffering from asymptomatic hyperuricemia. So there is increase in level of uric acid, but patient is not suffering from any sign and symptom of acute gouty arthritis, although the patient having hyperuricemia. So that is also possible, and this you can only able to diagnose if you are taking the blood sample and quantifying the level of uric acid in the blood sample. So this is in case of the uric acid test. In addition to that, few additional electrolyte level, like electrolytes such as the level of the sodium, then the potassium, chloride, bicarbonate, calcium, magnesium, phosphorus, protein, uric acid, and the glucose. It also gives certain level of indication about kidney dysfunctions. So when you are going through these or series of the tests, it will give you more confidence about whether the patient is normal or the patient might be suffering from certain kind of kidney disorder. So I'm done with my first part. So before going ahead, let's quickly have the quiz. So my first question is, what is the importance of reference value in clinical laboratory test? I want you giving the answer in the chat box. Let's see who gives the first answer. Okay, I have received answer from roll number 81 also. So basically the reference value, it helps you to differentiate whether the patient is healthy or patient is suffering from the disease. So any change in the reference value, any deviation from reference value, that is the indication of the disorder or the kind of disease patient suffering from. Okay, so that is important significance of the reference value. So as a pharmacist, you must know at least some basic reference value of some laboratory diagnostic test. Okay, my second question is, enlist different kidney function tests. 19 pair 81, the first to give the answer, he has mentioned about the BUN, that is blood urea nitrogen test. Very good. Blood urea nitrogen, serum creatinine test. Very good. What about other tests? Apart from uric acid, BUN and serum creatinine, even some electrolyte like sodium, potassium, magnesium, calcium, their level in the urine, that also indicates certain kind of abnormality in the patient. So it also gives the idea about the abnormality that patient might suffer from. So last question is, which test is highly sensitive indication of kidney impairment? So among different tests, which one is highly sensitive? Very good. 19 page 15, 95, 88, 98. Very good. Given the answer, it is the serum creatinine test. So serum creatinine test, it is the highly sensitive indication of the kidney impairment.